I thank the AIOC committee for giving me this opportunity. I also thank Dr. Boramani for inventing this wonderful technique and for the videos that he's lent me for this presentation. I'm happy to inform you that this technique got the Best Publication Award in the IJO of 2022. No financial interests. As always, I'd like to begin by remembering Dr. Kunwar Vikram Singh Dhaliwal, a young, wonderful surgeon who demonstrated this technique many times. You can still see his videos on YouTube. Unfortunately, he passed away at a young age, and his tragic loss was felt by many on a personal level, as well as the world of SICS in general. He was the one who coined the term nucleus endo-expression for this technique. So nucleus removal in MSICS involves pulling techniques and pushing techniques. Pushing techniques conventionally involve the use of an AC maintainer, as described wonderfully by Dr. Kimaya, irrigating vectis, and visco expression. But sometimes we are confronted with the Bahubali of cataracts, also called as the grade 4 hard nuclear cataract. At these times, we have to invoke a divine superpower. We have to invoke the Rajnikant of nucleus removal techniques, also called as nucleus endo-expression. Let's watch a video of this technique. Note the exquisitely shaped frown incision and the deep dissection into the sclera, the side pockets, allowing it a snake's mouth effect that allows you to accommodate a nucleus much larger than the size of the incision. Here the incision size is just 5.5 millimeters. So we prolapse the nucleus into the anterior chamber as usual with a Sinskey's hook. Then we depress the incision to engage the nucleus within it. We enter through the side port with the Sinskey's hook and then gently push the nucleus out. You can also use the Sinskey's hook to cartwheel the nucleus out, as shown here. Another demonstration. Here the surgeon has used the additional horsepower of an AC maintainer to push the nucleus out. The incision here is nasal, but you can also use it with any other type of incision. You can also use other instruments like the forceps to hold up the incision or a sheets glide to help the nucleus out. Some people prefer to use viscoelastic instead of an AC maintainer, but it's a matter of personal choice really. See, even in the movie Sholay, when Viru is overwhelmed by Gabbar Singh, he calls on the help of Jai. So similarly, other techniques can also be used to lend additional muscle power to endo-expression. Here the nucleus is so large and hard that it gets trapped within the incision and refuses to come out. So we can use the technique of phacofragmentation to bring down to the nucleus to a smaller size. We use the Sinskey's hook to chop off a part of the nucleus. Then we push the nucleus back inside, reorient it with its longer axis facing the incision, then engage the nucleus within the incision. And then push it out with a Sinskey's hook. So after seeing these surgeries, you must be worried what must be happening to the corneal endothelium and the iris. Is there a lot of trauma to it? But no, because if you notice that all the wrestling that we do with the nucleus is within the incision, so the corneal endothelium and iris are spared the injury. The advantages of this technique are, of course, you can remove a hard nucleus through a small incision without the risk of a nucleus drop. The disadvantages are damage to the corneal endothelium and iris, causing hyphema. But these two are seen with newcomers to this technique. Once you get the hang of it, the incidence goes down. Precautions are always good, You can, especially in cases of shallow AC and hypermetropic eyes, we can use a lot of viscoelastic and avoid iris entrapment during nucleus expression to avoid damage. Thank you for your patient listening.